Jerusalem is modern, ancient, it's hectic, patient. Jerusalem is a beauty to behold. Its walls are old and domes are gold. Jerusalem is spicy, dynamic, it's iconic, panoramic. Jerusalem is inspiring, unique, it's simple and chic. Jerusalem is brimming with styles, vibrant, charismatic, abundant smiles. Cobblestone streets, colored with sweets. Eclectic orchestra of authentic beats. It's the shoot, the basta, the shawarma. It's all about good karma. It's people, gates and views, culture, art and muse. Jerusalem is tradition, innovation. It's about openness, recreation. It's a city, destination, a goal. Jerusalem is how it feels to be whole. It's the knowledge, the courage, the drive to create. It's the source, the spirit, the reflection of faith. Jerusalem is Israel. It's Mediterranean chill. Jerusalem is real.
So welcome, shalom again. My name is Adi. I work at the international office at the Hebrew University of Jerusalem. I'm very excited to host everybody here for the International Master of Public Health virtual info session. We have here a large team from the public health program who will be very happy to answer all your questions also at the chat. It's very important faculty for the Hebrew University and a very prestigious program that we're very happy to present today. I'm very happy to introduce to all of you Professor Yehuda Neumark, who is the director of the Brown School of Public Health and Community Medicine at the Hebrew University of Jerusalem at the Faculty of Medicine. So Yehuda, please, you're welcome to share the presentation.
So thank you, Adi, and good afternoon, good evening, good morning to all of you where you might happen to be across the planet. And indeed, we welcome you to this information session. Feel free, use the chat, and we'll also have a live Q&A at the end of the presentation. My name is Yehuda Neumark, and I have the honor of heading the Braun School of Public Health and a former director of the international program. So now that we're here, where are we? Well, we're somewhere in the universe. More specifically, focusing down on the Middle East, and we're there in this little tiny corner of the planet that in ancient times was considered the center of the universe. And we believe that it is so. Well, when you arrive in Israel by plane, you'll be landing in the center of the country, the airport. Look for the sign to Jerusalem, and you will arrive on campus. When you get to the Hadassah Hospital in Karam campus in Jerusalem, look for the yellow sign outside hanging in the air, and that's where the School of Public Health is. So welcome to the Braun Hebrew University Hadassah School of Public Health and Community Medicine. We introduced the IMPH program staff. The IMPH is the acronym for the International MPH program, and we'll be using it a lot in the next few minutes together. Professor Ronit Calderon, director of the program. They're waving. Dr. Ronit Zinreich, our academic coordinator. I believe Raz Chuv, our social coordinator, is not with us this evening. Edna Perez, program administrator. Irina Zagmut, program secretary. Dr. Maureen Malawani, alumni coordinator. And Hannah Slutsky, our alumni communications officer. Besides just getting to see them and waving, I think that we can be impressed by the size of the staff that's dedicated to the IMPH program. We have about between 20 and 30 students each year, and considering that we have such a large staff, the staff to student ratio is intentionally high because we really want to take care of you while you're here in Israel. So before we proceed, just a word about what is public health. I'm assuming that if you're on this call, you have a fair sense of what it is that public health is. From our perspective, the definition by the American Public Health Association is the practice of preventing disease and promoting good health within groups of people, from small communities to entire countries. And that might include also the Korogocho slum in Nairobi, where we had the experience of training health professionals, medical teams there in our way of practicing community-oriented primary care. And we apply all of that which you will gain in your toolbox from studying here in Israel with the program to communities, whether challenged is this community is challenged or in other ways. Public health science and practice aims to promote healthy lifestyles, prevent, detect, and respond to public health threats, and improve healthcare quality, accessibility, and equity. On March 11th, 2020, the WHO detected and responded to a new public health threat by declaring COVID-19 as a pandemic. Exactly 1 year later, just a few days ago, Brazil announced that it is on the verge of collapse of the healthcare system because of COVID. Accessibility to quality healthcare is being challenged like it's never been challenged before the world over. We achieve these goals to the best we can through research, through training, and through influencing policy. Here at the School of Public Health, we have been influencing policy by working with government and NGOs and the clinical practitioners from the beginning of the pandemic till today by providing them with the epidemiological and other evidence that they need to make the decisions that has allowed Israel to come through the pandemic, and we are almost on the other side of it. We'll speak more about that as we go through. Our approach to public health research as to our training is multidimensional and holistic, from the molecular level through the individual and his or her experiences within his and her family and community, and then back again to the molecular. The research agenda here at the school is very broad. This is just a few of the topics that are addressed by the researchers here in the school. Most of you will be familiar with the SDGs, targets set by the United Nations for countries to achieve so that we might all achieve good health. But at the heart of every health system is the workforce, because without a properly trained workforce, these SDGs have no chance of being achieved. And therefore, many years ago, we set as the educational mission of the school to educate and train public health and community medicine specialists at a high academic and professional level, so as to improve the physical, mental, and social welfare of not only the population of Israel, but of the world over. Our school is the first school of public health in Israel, established back in 1961. And since then, we have been training both local experts as well as international experts in public health. Our school is accredited by AFIA, which is the accreditation body in Europe for schools of public health. And our international IMPH program is accredited as well by AFIA. Here at the school, we have numerous master programs an IMPH for Israeli students in Hebrew, a Master of Clinical Epidemiology, a Master of Health Administration, Master of Veterinary Public Health. We do short training programs and workshops, and we have an extensive PhD program. But we're here to talk about the jewel in the crown, and that is our International Master of Public Health program. It is a 12-month English program, English language program, full-time in campus. We are not online, and even today, even with the pandemic raging, our students are here in Jerusalem studying. Our students have all been vaccinated, as we have all the staff and teachers. And with proper precaution, we are able to teach in class and continue the curriculum as programmed despite all the challenges. Since its inception in 1971, we have graduated about 1,000 graduates from over 100 countries worldwide, North America, South America, Sub-Saharan Africa, Europe, former Soviet Union countries, Asia, Australia, New Zealand, and so on and so forth. To give you a sense of the breadth of who we are and who our students are, this is the class that's with us today, the current 2020-2021 cohort. And as you can see, students from across the globe. So why come study public health in Israel? Well, there's several reasons. One, Hebrew University of Jerusalem. If we look at the index of universities, with Harvard, Stanford, Cambridge being 1, 2, 3, MIT, and so on, well, Israel is within the top 100 universities in the world. And we are very proud of that. We're a medium-sized university with about 25,000 students, of which about 10% are international from over 90 countries. We have several campuses, 3 here in Jerusalem. And Hebrew University, one of its slogans is where science and knowledge are advanced for the benefit of humankind, which is what we believe public health is all about. Our curriculum here in the international program combines academic excellence with practical skills, practical tools, and knowledge. We know that for many of our students, this will be the only opportunity, perhaps, for formal training in public health. And it's therefore our goal to send you home at the end of the program with a fully laden toolbox of the skills with the skills and knowledge that you'll need to address the challenges that you'll face upon returning home. This is to give you a sense of the curriculum, quite broad, quite deep, quite challenging. Don't expect you to look at it and memorize it here, but you can go online and see a description of the course syllabi on our website. Requirements for admission into our program: either a bachelor's level degree, master's level degree, or an MD degree from a recognized university in one of the health fields or in one of the basic biology or social sciences field that are relevant to health. If you're unsure about whether your BA or MA is relevant, just ask. Probably we can find a link. We have lawyers, economists, social scientists, data experts, anthropologists, quite a broad range of disciplines, and we encourage that. We are not looking only for physicians. As a matter of fact, we don't only allow physicians in, We want a mix of professions in each classroom in each year. A minimum GPA of 80% as defined by our university. So when you register, you upload your transcripts. The transcripts go to our international office of the university, where they assess your transcript within the context of the country that you're coming from, and then give us a rating of your GPA as it would reflect back to our grades here, because we know that different universities in different countries have different grading scales. If you have a diploma or an advanced diploma, this is not recognized as an academic degree, and it would not grant you access to the program or entry into the program. And public health experience is definitely a plus, but we don't demand it. If you have it, you should certainly put it on your CV so that we can see it, but it's not mandatory, but it is a plus. Another reason for studying here with us is our scholarship program. So we have a limited number of scholarships each year for students coming from lower income or transition economy countries. And these are very generous scholarships that cover virtually all of the expenses required for the IMPH program and for living in Israel. Now, if you'll get a letter from us saying, "Dear applicant, we regret to inform you that you're not eligible for a scholarship," then what is the price tag? Well, it would cost you $8,000 US in tuition and covering all the other costs associated with studying in the university, plus living expenses. So this price tag does not include rent and food, toiletries, and so on. And Edna and other people here on our chat will be happy to answer questions further about the costs of joining the program. Also, we have the university, we have scholarships, and we have Jerusalem. It's an amazing city. And really, you don't go away unchanged. And while you're here, we'll show you all the beauty of the city. You'll experience with us all kinds of activities, hiking around the country, folk singing, rafting up north on the Jordan River, participating in the Jerusalem marathon, swimming in the Dead Sea, and so on and so forth. We also have a very extensive and wonderful program of professional site visits where we'll introduce you to a range of non-governmental services and programs that are affiliated and work with the government in promoting public health. We're happy to invite you to join us in celebrating our holidays as we will celebrate your holidays. And with the Passover holiday coming up, the Jewish Passover holiday coming up at the end of this week, on Wednesday, our students will celebrate with us a mock Passover meal and will be introduced to what the holiday is all about, the rituals, the foods, and so on. And if it weren't for COVID restrictions, our students would be hosted by local Israeli families to join them for the holiday festivities. We also have plenty of opportunities throughout the year for pomp and circumstance, for being proud of your country with traditional dress and flags and so on and so forth, mostly or also at graduation at the end of the year. And just hanging out together, enjoying one another's company. True, occasionally one has to study, so we do end up in the classroom, but above and beyond that, there's lots of time to enjoy Israel. Our graduates who complete the program successfully return home and enter back into clinical medicine, research, governmental offices, non-governmental, local or NGOs. Just a smattering of some of our graduates doing the work that they do back home. We have a very extensive alumni program, and we hold annual conferences or biannual conferences for our graduates, either here in Jerusalem or in Sub-Saharan Africa and other places. Our last one was in 2019 in Ghana on strengthening health systems. Little did we know how much that would be relevant just a few months later when Corona hit. So I'm going to stop here. Here is information for you for online registration, our website, and the email to contact Irina, our program secretary, with any questions that are not answered in the chat. And I turn the floor over to Dr. Maureen Malawani, our alumni coordinator, to introduce a few of our graduates to share with you their experiences.
Thank you, Yehuda. And I can see our numbers are growing. And as the IMPH Alumni Academic Coordinator, it is my great pleasure to give a very short introduction to 3 of our alumni who are with us today, who will talk to you for 5 minutes each on their experiences as part of the IMPH program. The first is Dr. Obsida, who joins us actually from Jerusalem. Obsida is from Ethiopia. After she graduated, she returned to Ethiopia, but has come back to Jerusalem to the school in this academic year to begin her doctoral program. The second is Nathan Reynolds, who hails from the United States. Nathan left our program, returned to the States. He was here on a Rotary International Scholarship, wanted to study medicine, was admitted to the Heritage College of Osteopathic Medicine in Cleveland, and has just graduated or is just in the process of graduating and matching from there. Our third alumna is Ardita Konjane, who joins us from Albania. Ardita is currently the health advisor to the Prime Minister, to her Prime Minister of the government of Albania, and she will talk about her experiences as well. So I now turn this over first to Obsi, then to Nathan, then to Ardita. I ask you all to please, if you have questions, put them in the chat, and we will answer them just as best we can or answer them after. Over to you, Obsi. Thank you so very much, all of you.
Thank you so much, Maureen, for the platform. My name is Obsi, and I came for the IMPH program in 2016, graduated in 2017. I'm originally from Ethiopia, and coming to the program, the best thing my first impression was living in an environment with people from a different country where you learn beautiful cultures, you make a beautiful friendship, and then everybody was welcoming, everybody was friendly, and everybody was culturally sensitive and understanding. And crossing over to the academic part, the academic aspect, especially the first semester, was an intensive training program, but also was an understanding of everyone's pace. So it was not only targeted for students who understand it very fast, but also for those who were struggling, and then it was graded accordingly. So that helped a lot of us to be comfortable and also to adjust with the new environment. The social activities within the program also give us that sense of discovering new spaces, learning a lot from the wonderful culture and traditions of Israel, and also how we could incorporate that into public health in our individual countries. Once I finished this program, I went back home and I took a teaching post at a university, and I was teaching my students research methods. And the tools and the academic output I got from the school not only helped me improve my teaching skills, but also on how I interact with my students. I learned a lot from my teachers on teaching pedagogy, how to grade students, how to interact with students, and also how to see public health from a perspective of a physician. For most of my training, I'm a physician, and I was trained to see a therapeutic medicine from an individual point of view. But adding public health and seeing the bigger picture is one of the greatest lessons I got from this program. And that's the best thing I will say one can learn through this program, through different tools throughout 12 months. If you have further questions, I will be happy to answer.
Thank you very much, Obsi. Thanks for making the new connection. All the very best. Nathan Reynolds.
Hi, good afternoon.
Cleveland.
Good afternoon. Can everybody hear my audio? Can you hear me?
Yeah,
more?
it's fine. It's fine. Thank you, Nathan.
So thank you for having me. I'm glad to be able to talk about this amazing program. My name's Nathan Reynolds. I'm living in Cleveland now, about to graduate from OU, HCOM, and matching in internal medicine. So my journey to the IMPH program at Hebrew Use really started with, I knew I wanted to apply for medical school, but I wanted to do something different before. So when I was looking at programs, I wanted, sort of a smaller cohort with a lot of different professions represented from a lot of different countries. So when I was searching for that, I found Hebrew University, and I was able to come up with the funding through Rotary International to help pay for the cost of the tuition and cost of living. And I'm very happy that I was accepted to the program. It set the foundation for what I was looking for really nicely. We covered research methods, epidemiology, statistics, health systems, everything that Professor Yehuda was talking about. And we did it in a way that, it's a lot of work. It's, 12-month program. It's rapid. But it didn't feel, the days are long, but the months are short, because it's a lot of fun as you're going through it, learning everything that you need to know to successfully complete the program. And looking back at the breaks that we had throughout the semester breaks, there was a lot of opportunities to enjoy Israel as well. We had the Mock Seder when we were there. I was back in 2013, 2014, we had no COVID restrictions, thankfully. And we had the Mock Seder. We had a lot of opportunities to tour the Old City. We went to the Israel Museum and to see the Dead Sea Scrolls, the trip to Eilat and Masada and exploring the Negev. So there are many opportunities outside of the classroom to enjoy the beauty of Israel. Been looking, I would love to be able to come back post-COVID to re-experience some of those. So hopefully in 2022 or 2023, I'll be able to come back. And applying, so once I graduated in 2014, I came back to the States and was applying to medical school, looking for jobs in the public health space. And I was able to find a position with the Cancer Center doing clinical trials in lung cancer and GU cancer specifically. And having that background and foundation in research methods and statistics from the program, that really helped me, move through the transition from research coordinator at Taussig Cancer Center now into medical school, and hopefully beyond, focusing on long-term. I'd like to get involved with HEMONC again as well, and having the foundation in research methods was really going to be helpful. So I'm happy to answer questions at the end if anybody has any for me specifically.
Thank you very, very much, Nathan, and all the very best with you this next move, and as you're matching and as you're staying in Cleveland. Ardita, over to you in Albania.
Hi, everyone. So I'm very glad to have this short talk with you. My connection with Hebrew University and the Brown School of Public Health didn't start exactly when I first entered the university or the class, but much earlier months when I was searching and looking for the best university and school that was providing public health studies, such as Hebrew University. And after I received the email from the school that I was admitted and I didn't see it, I received a phone call. And so I answered, and the person on the other side was just explaining me and introducing first of all, and then telling me that I was admitted and that I have to give an answer ASAP, like in 2 days. And I said, yes, like I don't need more time. He was like, are you sure? I said, yes, because this was my priority, and it was like a dream came true. So that was what I was waiting for. And the phone call was with Professor Yehuda, which I didn't know by then. But when we first met at school, I told him that I will never forget your voice, because the message that he gave me, it was so special, and it was something that I was waiting for a year. So, and of course, I never forgot his voice because of the epic classes and everything that happened during the studies. Why Hebrew U or the Brown School is the best? It's not because I'm proud of it and I love it because I am a graduate from this school, but because it is represented from a very great and special academic staff. This staff that is well known wherever in the world, but they are based in the Hebrew University. And this always made us, more proud from people who studied in other universities. Professor Yehuda Neumark is iconic character of the school. He was again the director of the school when I was a student. I'm a cohort of 2011, 2012. And we did have very good professors. Some of them are still present because I saw the presentation. I can mention Professor Ted Tulchinsky, who is famous on public health, or Paltiel, Ronit, all the stuff that they are not only professors, but then they become a family. For me, coming from Albania, I faced such a different experience in school. I have to mention that the program is very tough, but at the same time, you have to deal not only with professors, but also with friends, because for the first time, we saw that we were invited from our professors at their houses, at their families. So you get to know them better, you get connected with them. And so, it's even more easier than when you meet each other at school or at classes, or if you have issues and things that you have to solve out. So it's not that hierarchy like everywhere with the student and the professor, but it's much more than that. Again, the strategy that the school is using, this is like a life training, not only a professional training. I always say that because in Israel, you can easily see people working in the army, young people. At the beginning, you are surprised of that, but then it becomes like something commune. So also for me, I feel that I didn't only study public health, but I studied, how to live. And for us, we did have a lot of teamwork and group working, which actually, it was not only about to do the homework and present it, but it built bridges, relationship bridges among us, among our countries, and among our professional ideas. So the Brown School of Public Health, it opened not only a window to my future post-graduation, but a gate, I would say. I had a very good professional career up to now after the school, and I believe that Israel affected it a lot. Immediately after I came back, I started working for Save the Children International. They just opened, established the health department in Albania. So I was running it in a project on maternal and child health care. So for me, it was amazing coming from the studies and immediately having such a job like hands-on experience. And I was able to apply everything I learned at school. I then moved to the Swiss embassy because they were funding the biggest project on primary healthcare in Albania, working with nurses and doctors. So I felt like I had all the skills that I needed to run this project and to lead it. Like I feel so full, and for each job application that I did, I felt so confident because, I really had the skills that I needed. It is a one-year program, but Inside, it's much more than that. It's much more than a year, not only professionally and then in the academic facet, but also socially and experiencing a new culture. I also want to mention that I've been working with Israeli National Organization. I applied from my country, actually. Israel is the National Israeli Organization, humanitarian. And 3 years ago, they were searching for a head of mission in Italy because of the devastating earthquake that occurred in central Italy. So again, I got admitted. And I don't think that it was just by chance. Okay, I also speak Italian, but I don't think that it was enough if I didn't have my degree from HUJI. So the program started it was planned to be for a month, like just an emergency, but then it lasted for 3 years. So it was quite successful. And during this time, I was back and forth from home to Rome and also to Tel Aviv, to the headquarters. And of course, if I go to Israel, it's not, Tel Aviv is not enough. So I would always go to Jerusalem and to the school and meet my professors. So yeah, I got much more connected. I never felt that I left Israel. We've been always in touch. Because of my professors, I've always been pushed to apply, to research, to be part of different projects and be engaged. And so at the end of the day, I don't do just an administration work, but I come, I open my laptop and I had things to do on research. So I felt like, okay, everything was worth it. So, and I had, during these years, we also had many conferences. There is one I want to mention specifically, the International Health Policy Conference, which is always held in Jerusalem. So people from all over the world come there, and it's also a very good opportunity for the graduates to meet their classmates. So it's like a reunion and coming back to the family, because indeed the Brown School of Public Health is a big family for us. And we never feel disconnected. We have our WhatsApp, we have our groups, we share things with each other daily, I would say. So, I mean, it's a very good, high quality program. Of course, that if I would have again the chance to choose, I would go back on it and I would never do another choice. Israel is so special, it's so unique. I wouldn't compare it to any other country. And I always say to my friends, which most of them have already visited Israel because of me, that if there is a place that you must visit in the lifetime, is Israel. So I'm very glad to be part of it. Now I'm working as the advisor of the PM on health. And also when he admitted me, accepted my application for this job, and we launched the new government 3 years ago, he did a presentation of me and basically mentioning my studies experience in Israel and my work with Israel. So, I mean, Israel is very much appreciated, and also, I mean, in all the countries, but specifically in Albania, for me, it helped a lot and influenced my future life.
Thank you so much. Thank you so much.
I would also say the last sentence that I feel like the school vaccinated us with the knowledge of public health. I remember last year this time I was talking with Professor Yehuda, and I told him, you know, I'm so happy that the pandemic happened. I didn't know where we would go, but just at the beginning, and happy because people now know what is a public health expert, what epidemiology means. So we are more, you know, well known and appreciated.
Excellent point, Ardita. Excellent.
Yeah, thank you very much for having me.
Thank you so very, very much for joining us and for sharing your career stories and your personal stories. It's been a pleasure.
You know that I am a volunteer ambassador of Israel everywhere in the world. So
thank you. Thank you. Thank you very, very much. Okay, so I will turn this back to Yehuda. As a chair, we're moving now to the Q&A part of the of the session. We have 20 minutes until 7 o'clock. A number of you have joined late for whatever reason, only to say that there may be information on in the chat that would help you or would answer your questions. But just to repeat that we have on this call, we have our program administrator, Edna. We have our program secretary, Irena. We have the program director, Ronit Calderon. We have the school director, Yehuda. We have the curriculum director, advisor, Ronit Zinreich, all part of this call. So just write your questions. We're trying to keep track. What we can't answer now, we will answer later. They have put up the email that you can, Irina, would you just put that in one more time in the chat now, please? The IMPH email so that everyone sees it and that it's that's your starting point. If you feel that your question hasn't been, that we didn't get to you or it wasn't satisfactorily answered, or you have a follow-up question, or you have a question after this is over, then use the IMPH email and we will direct your question to the appropriate person. So now I'll open to Yehuda and whoever is going to manage and all questions and answers. So in the chat.
Thank you, Maureen, and thank you to our alumni for sharing with us. I see here also Joseph is with us, Takai. Hi, and looking for other graduates on board, but this really is for potential students, and therefore I'd like to open it up for questions that you might have that have not been answered on the chat, or you haven't had a chance to write on the chat. One question that I see is coming up several times is about staying in Israel after completion of the program. So Israel is quite restrictive about permanent residence here, and therefore all of our graduates upon completing the program and after graduation return home. Stellar students may be invited to come back for a PhD program, as Obsida is with us here now doing, but that's after spending some time back at home. So the option of staying in Israel after the MPH degree is obtained and working here is not an option. We like to think that this prevents brain drain to Israel, and that it also happens to be governmental policy. Other questions, raise your hand. I'll scroll through the screen if I see hand up. Any other questions? Shout out. If you have a question, you can be rest assured that other people have the same question. So do a service to your fellow participants and ask it.
There's a question of whether there's a preliminary exams. No, there are not. So I've just responded to that. But as Yehuda says, when one person asks a question, there are many who do. Someone also asked about how we calculate the percentage for your grade. We do not. You come in with a 3-point-something grade out of 4 or in that range, and Hebrew University, as any graduate program, will calculate your grade according to Hebrew University standards.
I see some questions regarding scholarships. So again, we do have limited scholarships available for students applying from low income and transition economy countries. The scholarships, if granted a scholarship, again, they're quite generous, but they are limited in number. the price or the cost of participating in the program without a scholarship is $8,000 US plus cost of living. That would be rent, food, toiletries, and transportation. And again, we'd be happy to speak with anybody specifically about what those costs might look like. In some countries, rent here might be more expensive or less expensive than what you'd be used to paying back home. And therefore, I think that would be most efficient to have an individual conversation with anybody who's interested in knowing what the specific cost might look like for you.
Some have asked if they should apply now. The answer is yes. Please do.
Yehuda, there was a question here at the chat. Someone asked, why would someone study public health, and to what careers does it lead for non-medical professionals? Can you please elaborate a bit?
Non-medical professionals, why would they study public health? Was that the question?
Yes.
Okay, so
opportunities.
As I mentioned earlier, our perspective on public health is quite holistic. And our training in public health is geared also for non-medical personnel. The public health teams that work in the field, either in practice or in research or in teaching, is much broader than merely physicians. We firmly believe in paraprofessional or in interprofessional, I should say, training. And therefore, we believe that a nurse, a lawyer, economist who has public health training will be a better nurse, a better economist, a better lawyer because of the public health training. There are so many challenges, and public health is such a broad field that people from a very wide range of professions have a role to play in public health. And
we've had students come from sociology, from the humanities side, sociology or anthropology, from pharmacy, which is not, I guess I would consider that science, from basic science, from demography, from geography, from urban studies and urban planning, from any of the and applied biological sciences, from social work, from degrees in psychology and applied psychology and counseling psychology.
Agriculture, fisheries.
Absolutely.
Veterinarians. We adopt a perspective of one planet, and our interface and our interactions with the animal kingdom continuously grows. And therefore people engaged in those areas also would benefit greatly from public health training. And as I said, our public health training is quite broad, so that the tools of epidemiology and the tools of statistics and economic analyses would benefit people, even if they're not medical professionals. Ronit, did you want to add something to that from a perspective of a physician, public health physician?
Well, I think that public health is useful for both for public health physicians and also for non-public health physicians, because it definitely improves the ability and the skills in conducting and understanding medical science and scientific literature. And about many of our graduates in Israel and around the world are working in public health services, either governmental or non-governmental. So I think it's usually a kind of a jumpstart or some kind of a change point in career that brings it to new horizons.
Other questions? Anybody with a hand up?
There are a couple of questions about English and English language. If you've been educated in an English language system, in an English language country, then you will not be required to do the IELTS, program, or that test, or the TOEFL test. If you are an English language speaker in an English language program in a country that is not an English language country, then you are most likely will have an interview, and it would depend upon your level of English as to whether or not you would be required to have a TOEFL or an IELTS grade of 6 or 6.5. Did that answer? There were a couple of you who wanted more clarification on the English. Please just ask if it isn't clear.
I think Monica wanted to ask a question.
Yes, please. Akinboyo.
Thank you. I'm Monica from Guatemala.
Monica, go ahead.
Monica.
Yeah.
Hola.
Hola, mucho gusto. Well, so my question is regarding the uploading of the files for the application. So let's say that I have one file that isn't like correct according to your regulations. Do you let me know that the file isn't okay so that I can upload it again?
Over to Irina.
I would not like to miss my application just because one file isn't right, you know. So.
Hi, Monica. I'm Irina. I'm the secretary of the program. So about the applications, anybody who has problems with uploading any document, you can send me an email on the email I shared in the chat. We'll try to work it out with the help desk, the actual IT support. If we do not manage to do it, then we'll work a way in between us. Then I'll help you upload from my side if that works. The only part that I can upload, the IT support should be able to help me with. So we'll try. Just send me an email if you don't manage, okay? And that goes for everybody. If you have any IT problems, please send me.
Okay, thank you. And if, let's say that I have like a diploma or something that does not fit your regulations, then you'll let me know so that I can get like an international approval or something that makes the diploma to be qualified for Israel.
So before any of the applications actually closed, before the deadline closed, I usually, and I have done that, that we send an email to all of the applicants of the missing documents. You should be very careful about the last 2 weeks before the application closes, that you would receive an email that you're missing some document, that we will be in contact together personally, so we could actually upload what's missing. About the degrees, if they're in the original language, they are required to be certified and approved and in an English language for us to accept it, as well to be uploaded with the original one in the original language of the country. Okay.
Okay, thank you very much. And thank you, Irina, because you have been helpful all this time.
Please. Dr. Ekoret, I can't see your last name. I'm sorry, you have a raised hand. Your question, please, sir. Dr. Ekoret Francis Ekpo. You have a question? Does the university have, no, I think I answered. You asked if the university had a list of countries that would be granted exemption, and I said no. But we, and I answered that. We have two other hands up. Nidhi Mankar. Nidhi Mankar, your question, please. One more thing. Does the candidate who wants to apply for a scholarship should do the same goal of sending in the application for IMPH online? What exactly is the procedure to apply? The application form has various fields, of which the application for scholarship says not needed. So does anyone else want to answer that in terms of admissions? You apply to the program, and depending upon your application or your country of application, I believe that you'll be asked, Irena, correct me, will you be asked to state if you are requesting information on scholarships or you would like to be considered for a scholarship? Irena?
So there is an option of the scholarship justification. Not everybody is you don't have to do it if you don't want to apply for a scholarship. The scholarships itself is considered for a certain amount. It's very limited. The best of the best. We do not go on any kind of discrimination between countries or any. It's professional background and academical background that we actually look at. So if anybody wants to ask about the scholarships more, you are always welcome to send to the email that I shared in the chat, and we will answer one by one, no problem.
I see hands raised. Claudia, did you want to ask a question?
Yes, thank you. Good morning. I am Claudia from Guatemala.
Hello, Claudia.
Hello. It's so nice that you do this meeting. Thank you so much. I want to ask something. I applied in 1919 and my application was denied, but I never knew what I have to improve for next opportunities. And someone sent me this invitation, and how do I know what do I have to do better? Because I know I was denied, but never was told specifically what I should do better. I sent everything as you have said. I made my translations, everything. Probably it's my essay, or I don't know. How can I know how to improve?
Well, firstly, let me assure you, Claudia, that it's nothing personal. We have many candidates for the program, and it's a small program, and we intentionally keep it as a small class, as an intimate class. So for 25 spots in the classroom, we might have 300 or more applicants. And some of the scholarships are dedicated for specific regions or for specific or other criteria, so that, you know, if we're able to award 20 scholarships, those might be difficult to align with some of the applicants, even if their application is wonderful. What can you improve? Well, I don't know. Obviously, I'm not familiar with your particular file and application. Again, we're looking for excellence in previous academic engagements. So a bachelor's degree, master's degree, medical school, nursing school, wherever it might be. Letters of recommendation from senior professionals, employers, attesting to your professional acumen, as well as your ability to be a team player, and so on and so forth. Yes, the autobiography is important so that we get a sense of who you are. What can I say? I encourage you to reapply.
Yes.
I must say, we've had students who applied 2 or even 3 times. And eventually, occasionally, limited have been accepted after multiple applications. But, you know, there is a cost of ego and so on, self-esteem, not ego. So reach out to us and perhaps.
Perhaps, yes. I am a clinical psychologist, so I can work with that part of the ego.
Well done.
Well done. Well done.
Abraham?
Thank
Abraham
you.
Simon, did you have a question?
I think
Hello?
I think we have 1 minute to go.
Hello?
Yes,
Hello?
Abraham, go ahead.
Hello, good evening.
Yes, Abraham, we can hear you.
I'm Abraham Simon from South Sudan. And I will be short because she's saying only we have 1 minute. I have one question. And basically, I'm a medical doctor. I started my specialization in internal medicine for 2 years in Egypt, but unfortunately, because of funding issue, and I decided to shift to public health, to different thing. And then I heard about this program from my colleagues. One of my colleagues already now, she's in Israel. She's starting the program. And my question was, when I start my specialization, I enter for TOEFL examination. So my question was, the TOEFL examination, it was since 2016. So the program doesn't need an updated certificate, or the same certificate for 2016, it will be okay for that program.
I'm not sure I understood the question fully.
The question is about TOEFL requirement. If the exam and the TOEFL was actually from 5 years ago or 5.5 years ago, would that be acceptable? We have not received. We don't. At this point, I don't know that we could say. If you have continued to work and or study and or in English since the time of your TOEFL and your TOEFL score was acceptable, then we would probably interview to be sure. But I think that a 2016 TOEFL score would be acceptable. But I can't give you a firm. What you do, please do write to us, and we will check if there's a Hebrew University policy on that. Thank you.
Yes, thank you so much. And as you know, our country is now basically they're using English language. But my certificate, since it's from Sudan, before the separation,
from
as you know, you guys.
Sudan.
Yes, Sudan. So basically, it will be like this country the English language was not the basic language.
No, we're very familiar with your area, Abraham. So please do write to us with any questions, and we will also check to see if a 2016 TOEFL is acceptable. Thank you very much.
Right.
Thank you very much.
Thank you so much.
Adi, as our formal timekeeper, are we?
I think we have a few more minutes. There was a question here regarding the online learning and how the studies continue during this time of COVID-19.
So if we'll have any online learning, it will be hybrid learning while staying in Israel. No one is going to study from their home country. The Corona time experience that we had was such that we learned that it's not really feasible for our students to study from their home countries. So at least for next year, we don't plan any online learning if it's unnecessary. And if it will be conducted, it will be while staying in Israel.
Let me make a general comment about that, if I may continue on Ronit's point. There are numerous online MPH programs in the world, and many people studying public health are studying online, studying virtually, even before COVID. We have, over the years, considered converting our program to an online program multiple times. And in our discussions with our students and our graduates, every time we have come up with the same conclusion. The experience of studying here, in person, in class, with professionals from across the world, from different cultures, different traditions, different religions, different professions, sexes, ages, is in an experience that cannot be emulated online. And for us, it's very important that you come here, come to Jerusalem, come to Israel, see what our little corner of the planet is all about. It's a little more than what you might be seeing on the news back home, and you might be very pleasantly surprised. I think you will be. So COVID or no COVID, we're going to continue providing our MPH program in class, on campus, here in the lovely city of Jerusalem.
I'm very also happy to add that starting April 4th, all the students at all the campuses of HUJI are coming back to campus, which is very exciting for all of us. At the Faculty of Medicine and some of the sciences, many students continue to work at the labs, but I'm here now, for example, at Mount Scopus, at the other side of Jerusalem, and we're really excited to see in 2 weeks all the students after the vaccines, all the international students were vaccinated, and I assume most of the Israeli students also, and everybody are coming back into the campus, all the ones that were vaccines, and it's super exciting.
Yes, I personally teach a course later in the second semester, 275 students. Now, how we're going to do that on campus is a bit challenging, but we've worked it out, and we will maintain strict adherence to government regulations, but we will be back on campus with all the students spending at least some of the classes in class. So we wish ourselves best of luck as we move to the next stage, as we move out of, hopefully, out of COVID. Last question or two? Any hands raised? Any last minute comments? Ladies and gentlemen.
You have Ayele, who is raising a hand.
Is that Ayele?
You're muted.
Yes.
Go ahead, sir.
Thank you, Professor, for your preparing this discussion. I'm very happy to follow your online virtual discussion. It is very important for me and for others who want to follow this master program. And it is very important for me. I have got new information from your discussion. So I will try to apply as you teach us or as you give us information. So I would like to say thank you for your online discussion. It is very important.
Thank you, and we look forward to receiving your application.
Okay, okay.
Last question, Nidhi Mankar.
Hello, am I audible?
Yes, you are.
Hello, hi. Thank you for detailing on the entire thing. Just one question I had was, I am right now in my online profile of the application. So there is a section of document status, and there are a list of items that gets green ticked every time it gets uploaded or it gets confirmed. So there's a number. There's number 2, which says scholarship justification request, and then it says status, and then it says whether it is required or not. So for me, it is entitled as no. So I just wanted to have a clarification on that, whether how do I go with it? So if I need a scholarship, do I need to type another justification letter and then upload it, or how is it going to be?
Irena?
Hi. So the justification letter should be exactly not more than 300 words.
Okay.
So if it's more, it might be too big for the document to be uploaded. I would suggest that you would send me an email. Try minimizing a little bit the justification letter. If it doesn't upload, then we'll try to speak with the IT support and see what we can do. Okay.
Okay, thank you. But then it just say it just tells me that it is not required on my file. It just says that no. So I don't really understand how that works.
A computer is a computer, and if it's a glitch, we'll try to fix it. Everybody is entitled to write a scholarship request justification. It's not required, it's an option. So you can write a scholarship justification.
Sure,
okay?
Thank you. Sure,
no
thank
problem.
you.
So I did say that was the last question, but I see a hand up, and it's hard to let you go after you've been with us the whole time and you have a question. So for those of you who have to leave, I bid you farewell, and we're very glad that you were joined us and you were here with us. And again, as you've heard, please reach out to us via mail, and we'll be happy to answer any specific questions you have. I can guarantee you that Irina reviews all of the material that comes in from the application, from the online application site, and we'll be in touch with you if there is a problem with any piece of your application material. And if you've applied your application, you will be invited to make sure that your application is complete, and we will let you know what is incomplete if there is anything that's incomplete. So if you leave us, farewell, shalom, keep safe, keep sane, and we will get through it all. We look forward to seeing you in Jerusalem. Be well. If anybody has questions, I see Corto and Gervais, Nagia. So Corto, if you have a question.
Yes, this is Gervais. Good evening, everyone.
Yes, okay, go ahead, sir.
I am so grateful for this session. I have been so keen, and most of my questions have already been answered, even from your closing remark. Presently, I'm in Cameroon. I'm a nurse by profession with a bachelor's in nursing sciences. I work with Doctors Without Borders in the crisis-stricken region of the Northwest. My work specialty is with community. And my colleague who is presently there, Dr. Ako, is the one who enlightened me about this program, because we have always been discussing about our dreams and things like this. So he told me the session is going to hold, and he sent me the link. So I'm really grateful, and I'm going to apply. Like you said, there will be a guidance on the application process up to, and I'll be so grateful to get to Israel someday.
Excellent. Good luck.
Thank you. Thank you, Professor.
Any other questions?
Corto, you have your hand raised. Did you have a question?
I see Richard in the meantime has raised his hand. Richard?
Yes, good evening, everyone from Uganda. I just had a very small...
I'm not connecting you, God, to ask my question.
Yes, this is Richard from Uganda.
Sorry, 1 second, Richard. Corto, okay, go ahead. We'll try to do this. Go ahead,
yes,
Richard.
Thank you so much. This is Richard again from Uganda. I just had a very small question requiring a clarification. On the, according to Prof's presentation, I think we have, there's a scheduled module regarding non-communicable diseases, but on the website, when you look at the syllabus and the course contents, it appears that the non-communicable disease module is not on, both for the electives and then the core modules. Could it have been probably an omission, probably on the current syllabus, which was uploaded on the website, or something like that. Yeah, I'll just beg for some clarification. I have particular interest in non-communicable diseases because it's an emerging threat across the globe, in addition to all the other ailments. So that's the background against which I asked that question. Thank you.
So if I understood correctly, you're asking specifically about a course or module on non-communicable diseases?
On NCDs, yes.
On NCDs?
Yes, sure. Yeah, sure.
So I can say that while we don't have a specific course on chronic non-communicable disease per se, issues of NCDs comes up in many of our courses, is addressed in a wide range of frameworks, whether it be in epidemiology, in the COPC workshop. So indeed, we don't have a dedicated course to NCD, but we certainly we're certainly very aware and sensitive to the double burden of disease that has emerged in sub-Saharan Africa and other countries, of not only the traditional communicable infectious diseases, but also chronic illness and beyond. So it's there, and you will be able to go home with quite a fair bit of information, skills, and so on. Let me just add that all students do either a master's thesis or a master's paper, and the topic of that thesis or paper is something that is, it's something that is relevant to the student. And as long as we can find an advisor, every student has a personal advisor for their paper or their thesis. So if we can find an advisor for a topic that you bring to the table, that you wish to address, if you have data that you bring with you and you want to analyze the data, you want to do a policy analysis about your own country, we will do our utmost to make sure that you address that topic in your paper or your thesis. So fear not, non-communicable diseases has not been ignored in our program.
Yeah, sure. Thank you so much for the response.
Okay.
It's encouraging, yeah, sure.
Ladies and gentlemen, with that, I close our virtual information session on the IMPH program. Once again, thanking you for your participation, your attention, and again, inviting you all to submit applications if relevant. And if you have any questions, reach out. We're here to answer them and to help you through the application process. God bless, Godspeed. Be well.
Thank you all.